Dr. Lisa Martinez was 3 hours into cataloging the latest donation to the Pittsburgh Industrial Heritage Foundation when she encountered the photograph that would change her understanding of early 20th century urban life forever. Among hundreds of images documenting immigrant families in Pittsburgh's steel districts, one portrait from 1912 stopped her cold. The photograph showed a young mother, perhaps in her mid-20s, holding her son of about 8 years old. They were posed in front of what appeared to be their modest home in one of Pittsburgh's industrial neighborhoods. The mother wore a simple dark dress with a small brooch at the collar, her hair carefully arranged despite obvious signs of poverty. Her expression was proud but weary, the look of someone working hard to maintain dignity in difficult circumstances. The boy sat on his mother's lap, dressed in his best clothes, knickers, a white shirt, and a small jacket that had clearly been mended several times. But it was the child's face that made Dr. Martinez pause her cataloging work entirely. While the mother gazed directly at the camera with clear, focused eyes, the boy's expression was hauntingly different. His eyes appeared unnaturally large and seemed to stare past the camera rather than at it. There was something vacant yet deeply troubled in his gaze, an expression that seemed far too knowing for such a young child. Dr. Martinez had spent 15 years studying historical photographs of immigrant families, but she had never seen a child's expression quite like this one. The boy didn't look frightened exactly, but there was something profoundly wrong that she couldn't immediately identify. The photograph's backing bore the stamp Romano Photography Studio, Lawrenceville District, Pittsburgh, August 1912. A handwritten note in faded ink identified the subjects as Mrs. Anna Kowalski and son Michael, age 8. As Dr. Martinez prepared to move on to the next photograph, something made her reach for her magnifying glass. The boy's pupils were what caught her attention. They seemed unusually dilated for a photograph taken in daylight, and there was a strange quality to his gaze that she'd never encountered in historical portraits. She had the unsettling feeling that Michael Kowalski's eyes were trying to tell her something across the span of more than a century. Dr. Martinez contacted Dr. Robert Chen, a colleague at the University of Pittsburgh who specialized in historical medical conditions and their documentation in photographs. When she emailed him the image of Anna and Michael Kowalski, his response came within hours and was more urgent than she had expected. "This child shows classic signs of neurological distress," Dr. Chen wrote. "The vacant stare, dilated pupils, and what appears to be facial asymmetry suggest serious medical issues. Can you find any medical records from 1912 Pittsburgh that might relate to this family?" Dr. Chen explained that early 20th century photographs often inadvertently documented medical conditions that families didn't understand or couldn't afford to treat. "The expression on this boy's face isn't shyness or camera nerves," he said during their phone conversation. "Those eyes suggest significant neurological impairment." Dr. Martinez began researching the Kowalski family in Pittsburgh city records from 1912. She found them listed in the city directory as residents of 412 Butler Street in Lawrenceville, one of Pittsburgh's most densely populated immigrant neighborhoods. Anna was listed as a widow and Michael as her only child. The 1910 census showed that Anna's husband, Joseph Kowalski, had died in 1911, leaving her to support Michael by taking in laundry and sewing. They lived in a tenement building that housed 12 families, mostly Polish and Italian immigrants who worked in Pittsburgh's steel mills. But what Dr. Martinez found most significant was the neighborhood itself. Lawrenceville in 1912 was one of Pittsburgh's most polluted districts, located directly downwind from several major steel mills and chemical plants. The air quality was notoriously poor, and the neighborhood had some of the highest rates of childhood illness in the city. She located medical records from Pittsburgh General Hospital that showed an unusual pattern of neurological symptoms among children in the Lawrenceville area during 1911 and 1912. Doctors had noted increasing cases of children exhibiting nervous conditions, including seizures, behavioral changes, and what they described as mental sluggishness. However, medical understanding in 1912 was limited. Most doctors attributed these symptoms to weak constitution, nervous temperament, or industrial vapors, without identifying the specific cause. Dr. Martinez was beginning to suspect that Michael Kowalski's haunting expression documented something far more sinister than a simple childhood illness. Research into Pittsburgh's industrial conditions in 1912 revealed a horrifying picture of environmental contamination that city officials and factory owners had systematically ignored. Dr. Martinez discovered that the Lawrenceville neighborhood where the Kowalski family lived was situated in what industrial hygienists would later recognize as one of the most toxic environments in American industrial history. The Romano Photography Studio, where the Kowalski portrait had been taken, was located just 3 blocks from the largest lead smelting operation in western Pennsylvania. City health records from 1912, buried in municipal archives, showed that the neighborhood's children had been exposed to levels of airborne lead that would be considered catastrophically dangerous by modern standards. Dr. Martinez contacted Dr. Elena Rodriguez, a specialist in environmental health history at Carnegie Mellon University. When Dr. Rodriguez examined the photograph and learned about the family's location, her assessment was grim. "What you're seeing in this child's eyes are almost certainly the neurological effects of severe lead poisoning," Dr. Rodriguez explained. "The vacant stare, Dilated pupils and general facial expression are consistent with lead encephalopathy, a condition that was killing and brain-damaging children throughout America's industrial cities in the early 1900s. Lead exposure in 1912. Pittsburgh came from multiple sources. The paint in tenement buildings contained high levels of lead, which created toxic dust as it aged and peeled. The neighborhood's proximity to smelting operations meant that lead particles constantly settled on surfaces where children played. Even the water pipes in many buildings were made of lead, contaminating drinking water. Children were particularly vulnerable because their developing nervous systems absorbed lead more readily than adults. The symptoms, behavioral changes, learning difficulties, seizures, and eventually death, were often misunderstood by doctors of the era as signs of weak character or inherited deficiencies. Dr. Rodriguez found documentation showing that in 1912, the child mortality rate in Lawrenceville was nearly 3 times higher than in Pittsburgh's wealthier neighborhoods. City health officials had noted the disparity, but attributed it to poor immigrant hygiene rather than environmental contamination. The tragedy is that the technology existed to identify lead poisoning in 1912, Dr. Rodriguez said, but there was no political will to protect working-class children, especially immigrant children. Their families had no voice in city politics. The photograph of Anna and Michael Kowalski had captured not just a mother's love, but evidence of a public health crisis that authorities had chosen to ignore. Anna Kowalski's story began to emerge through church records, immigration documents, and social service reports that Dr. Martinez uncovered at the Heinz History Center. Anna had arrived in Pittsburgh from Poland in 1903 with her husband Joseph, both seeking better opportunities in America's booming steel industry. Joseph had found work at the Jones and Laughlin Steel Company, but like many immigrant workers, he faced dangerous conditions and low wages. When he died in a workplace accident in 1911, Anna was left with no income beyond what she could earn taking in laundry and doing piecework sewing. The records painted a picture of a woman fighting desperately to care for her son while struggling with his increasingly disturbing symptoms. Reports from St. Adalbert's Catholic Church, where Anna attended services, mentioned that she had repeatedly asked the priest to pray for Michael's mysterious illness. A social service report from the Associated Charities of Pittsburgh, dated March 1912, documented Anna's request for help with Michael's medical care. The caseworker noted, "Child appears listless and confused. Mother reports episodes of violent behavior in periods where the boy seems unable to recognize familiar people. Local physician attributes symptoms to nervous constitution and recommends rest and better nutrition, but family cannot afford proper food." Dr. Martinez found that Anna had taken Michael to 3 different doctors between 1911 and 1912, spending money she could barely afford. None of them had correctly diagnosed lead poisoning, partly because the condition wasn't well understood, and partly because immigrant families were often assumed to be exaggerating their children's symptoms. The most heartbreaking document was a letter Anna had written to her sister in Poland, discovered in a collection of immigrant correspondence. Written in Polish, but translated by a university linguistics department, the letter revealed Anna's growing desperation. Michael grows stranger each day. He stares at nothing for hours, then suddenly becomes wild and angry. The doctor says it is his temperament, but I know something evil lives in our house. The other mothers whisper that the air itself is sick here, but we have nowhere else to go. By the time the photograph was taken in August 1912, Anna had been watching her son's mind deteriorate for over a year, with no understanding of why it was happening or how to stop it. Dr. Martinez's investigation revealed that Michael Kowalski was not an isolated case. Pittsburgh City health records from 1910, 1915, found in the basement archives of the Allegheny County Health Department, documented what could only be described as an epidemic of childhood neurological disorders in immigrant neighborhoods. Dr. James Morrison, Pittsburgh's city health officer from 1909 to 1915, had kept detailed but largely ignored records of childhood illness patterns. His report showed that children in Lawrenceville, the Hill District, and other industrial neighborhoods were developing neurological symptoms at rates 5 to 10 times higher than children in wealthier areas of the city. Morrison's 1912 annual report, buried in city council records, included a section titled "Concerning the Mental Health of Working-Class Children." In carefully worded language, Morrison had tried to alert city officials to what he suspected was environmental poisoning. The prevalence of nervous disorders among children residing in proximity to industrial operations suggests a correlation that demands immediate investigation. The symptoms observed, including mental sluggishness, behavioral disturbances, and seizures, appear with suspicious frequency in neighborhoods where lead-based industries operate. However, Morrison's recommendations for environmental testing and regulation were rejected by the city council. Minutes from 1912 council meetings show that industrial representatives argued that such regulations would harm Pittsburgh's economic growth, and that childhood illness was more likely due to immigrant living habits than industrial contamination. Dr. Rodriguez discovered that similar patterns were occurring in industrial cities across the United States. Cleveland, Detroit, Chicago, and other manufacturing centers were all experiencing unexplained epidemics of childhood neurological disorders in immigrant neighborhoods. What's remarkable about Dr. Morrison's records, Dr. Rodriguez noted, is how accurately they documented the lead poisoning epidemic, even though the medical understanding wasn't there yet. He was seeing the pattern decades before anyone understood the connection. The Romano Photography Studio records provided additional evidence. Between 1910 and 1915, the studio had photographed hundreds of immigrant families, and a disturbing number of the children showed signs similar to Michael Kowalski's: vacant stares, unusual facial expressions, and evidence of neurological distress. These photographers were inadvertently documenting one of the worst public health disasters in American history, Dr. Martinez realized, and nobody recognized it at the time. Dr. Martinez's research took a significant turn when she connected with Dr. Paul Stewart, a retired pediatric neurologist who had spent his career studying historical cases of lead poisoning. Dr. Stewart had been tracking similar cases through historical medical records and had developed expertise in identifying lead toxicity symptoms in early 20th century photographs. When Dr. Stewart examined the Kowalski photograph using modern digital enhancement techniques, his analysis was devastating. This child shows advanced signs of lead encephalopathy, he concluded. The facial asymmetry, eye positioning, and general expression indicate significant brain damage that would have been progressing rapidly. Dr. Stewart explained that lead poisoning attacks the developing nervous system in predictable ways. The vacant stare that's so unsettling in this photograph is actually caused by damage to the frontal lobe. The child is literally losing cognitive function as the lead accumulates in his brain tissue. Using computer analysis, Dr. Stewart identified several specific indicators in Michael's appearance that confirmed severe lead exposure: the slight drooping of one eyelid, the asymmetrical facial expression, and the positioning of his hands all suggested neurological impairment consistent with heavy metal poisoning. By the time this photograph was taken in August 1912, this child probably had less than 6 months to live, Dr. Stewart said grimly. The level of neurological damage visible here would have been irreversible and ultimately fatal. Dr. Martinez contacted the Pittsburgh Department of Environmental Health to see if any soil samples from the former Kowalski neighborhood had ever been tested for lead contamination. The results were shocking. Even after more than a century, soil samples from the Butler Street area where the family had lived still contained lead levels more than 50 times higher than EPA safety standards. This neighborhood was basically a toxic waste site, disguised as a residential area, explained environmental specialist Karen Walsh. The lead contamination was so severe that it's still dangerous today, over 100 years later. The photograph of Anna holding Michael had captured a moment when her son was dying from preventable lead poisoning, but neither she nor the medical professionals of her time understood what was happening. Michael's eyes weren't just showing illness, they were documenting one of America's first major environmental health disasters. As Dr. Martinez delved deeper into Pittsburgh city archives, she uncovered evidence of a systematic cover-up of the lead poisoning epidemic. Internal correspondence between city health officials, industry representatives, and political leaders revealed that the dangers of lead exposure were known but deliberately suppressed. A memo dated January 1913, found in the Pittsburgh Mayor's archived papers, showed that City Health Officer Dr. Morrison had presented compelling evidence linking childhood neurological disorders to lead-based industries. The mayor's response was telling. Dr. Morrison's concerns, while well-intentioned, cannot be allowed to interfere with Pittsburgh's industrial development. Alternative explanations for childhood illness must be emphasized. Dr. Martinez found similar correspondence from the Pittsburgh Chamber of Commerce, which had organized a coordinated response to downplay environmental health concerns. A 1913 letter from the chamber to local newspaper editors urged them to avoid publishing stories that might unnecessarily alarm the public about industrial safety. The lead industry itself had conducted its own studies showing the neurological effects of lead exposure on children, but these studies were kept confidential. Dr. Martinez obtained copies of these documents through the University of Pittsburgh's Industrial History Archives, which had acquired them from corporate donations decades later. One particularly damning document was a 1912 report commissioned by the National Lead Company, which operated the smelting facility near the Kowalski neighborhood. The report's conclusions were unequivocal. Prolonged exposure to airborne lead particles causes irreversible neurological damage in children under 10 years of age. Immediate remediation of residential areas within 2 miles of smelting operations is recommended. However, instead of implementing safety measures, the company had decided to suppress the report and continue operations without changes. Internal memos showed that company executives believed the cost of environmental protection would be prohibitive and that immigrant families had little political power to demand changes. The science existed in 1912 to prevent what happened to Michael Kowalski and thousands of other children, Dr. Martinez realized. But corporate profits and political indifference created a conspiracy of silence that lasted for decades. Dr. Rodriguez found evidence that similar cover-ups had occurred in industrial cities across the United States. The lead industry had developed a sophisticated public relations campaign to deny the dangers of lead exposure while continuing to profit from products they knew were killing children. The photograph of Michael Kowalski had accidentally preserved evidence of this deliberate negligence, showing the human cost of prioritizing industrial profits over public health. Determined to learn what happened to Anna and Michael Kowalski after the photograph was taken, Dr. Martinez expanded her search through Pittsburgh death records, immigration documents, and church registries. What she discovered confirmed Dr. Stewart's grim prognosis. Michael Kowalski died on February 15, 1913, just 6 months after the photograph was taken. His death certificate, found in Allegheny County records, listed the cause of death as nervous exhaustion and seizures, the terminology doctors used in 1913 when they couldn't or wouldn't identify the true cause. The death record showed that Michael had been attended by Dr. Frederick Walsh, a physician who served Pittsburgh's immigrant communities. Dr. Walsh's medical notes, discovered in his archived papers at the University of Pittsburgh Medical Center, provided a more detailed picture of Michael's final months. The boy's condition deteriorated rapidly after October 1912, Dr. Walsh had written. Frequent seizures, loss of speech, and periods of violent agitation. Mother devoted entire time to his care but could afford little medication. Child appeared to be suffering from advanced nervous system disorder of unknown origin. Anna Kowalski had spent her final savings on Michael's medical care, eventually becoming dependent on charity from St. Adalbert's Church. Parish records showed that she had worked tirelessly to care for her son, often going without food to afford his medications. After Michael's death, Anna's own health declined rapidly. Church records indicated that she developed what the priest described as melancholia and became increasingly isolated from the community. She died in November 1915 at age 29, with the death certificate listing tuberculosis and general debility. However, Dr. Martinez suspected that Anna had also suffered from lead poisoning, as adults living in the same contaminated environment often developed neurological and physical symptoms, though less severely than children. The Romano photography studio records showed that Anna had returned twice to look at Michael's photograph after his death, but she had never been able to afford to purchase a copy. The image had remained in the studio's files until the business closed in 1920. Anna Kowalski spent her son's final months watching him die from a preventable disease that could have been easily avoided if the city had regulated industrial pollution, Dr. Martinez reflected. She never knew what killed him, and she never knew that his suffering was completely unnecessary. The photograph had captured not just a mother's love, but the last happy moment in a tragedy that could have been prevented by political will and environmental justice. Dr. Martinez's research had uncovered far more than a single family's tragedy. She had documented one of America's first major environmental justice disasters. Her findings demanded a public response that would honor the memory of Michael Kowalski and the thousands of other children who had died from preventable lead poisoning. She organized a symposium at the University of Pittsburgh titled Hidden in Plain Sight: Pittsburgh's Lost Children and the Lead Poisoning Epidemic of 1910 to 1920. The event brought together historians, medical experts, environmental scientists, and community activists to examine the historical parallels with contemporary environmental health issues. The symposium attracted national attention when Dr. Martinez revealed that many of the same companies responsible for the 1912 lead poisoning epidemic had continued to suppress information about lead dangers for decades afterward. Some of these corporations were still operating and had never acknowledged their role in the deaths of immigrant children. Community activists in modern-day Lawrenceville, many of them descendants of the families who had lived there during the lead epidemic, demanded that the city officially recognize what had happened to their ancestors. They organized memorial events and pushed for historical markers, acknowledging the environmental injustice that had occurred. Rodriguez's environmental testing revealed that lead contamination remained a problem in many of Pittsburgh's formerly industrial neighborhoods. Soil samples from areas where immigrant families had lived in 1912 still exceeded safe lead levels, and some children in these neighborhoods continued to show signs of lead exposure. Michael Kowalski's story isn't just historical tragedy, Dr. Rodriguez explained at a community meeting. It's a reminder that environmental racism and the sacrifice of poor communities for industrial profit continue today. We have an obligation to learn from his death and prevent similar tragedies. The Pittsburgh City Council passed a resolution acknowledging the lead poisoning epidemic of 1910 to 1920 and officially apologizing to the families who had been affected. The resolution included funding for continued soil remediation in formerly industrial neighborhoods and enhanced testing for lead exposure in children. Most significantly, the Michael Kowalski case became part of environmental justice curricula in universities across the country, helping students understand how industrial pollution has historically affected poor and immigrant communities disproportionately. The photograph of Anna holding her dying son had become a powerful symbol of environmental injustice and the importance of protecting vulnerable communities from corporate negligence. The Pittsburgh Industrial Heritage Foundation created a permanent exhibition titled Anna's Eyes: A Mother's Love in the Face of Environmental Tragedy, featuring the 1912 photograph of Anna and Michael Kowalski, alongside the complete documentation of Dr. Martinez's investigation. The exhibition drew visitors from around the world, many of them moved to tears by Anna's expression of fierce maternal love juxtaposed with Michael's haunting gaze. The display included interactive elements that helped visitors understand how lead poisoning affects the developing brain and how environmental contamination continues to threaten children today. Dr. Martinez received letters from families across the United States who recognized similar symptoms in their own ancestors' photographs. Several other cases of historical lead poisoning were identified and investigated, creating a broader understanding of how widespread the epidemic had been. The Anna and Michael Kowalski Memorial Fund was established to support environmental health research and advocacy in low-income communities. The fund provided grants for soil testing, childhood lead screening, and community education about environmental hazards. Most meaningfully, the Polish-American community in Pittsburgh embraced Anna and Michael's story as representative of the immigrant experience in industrial America. Annual memorial services were held at St. Adalbert's Church, where community members lit candles for all the children who had died from preventable environmental diseases. Dr. Martinez often returned to look at the 1912 photograph, still struck by the contrast between Anna's loving expression and Michael's vacant stare. Anna couldn't save her son from the lead poisoning that was killing him, she reflected. But her love preserved his image and allowed his story to eventually save other children. The photograph had traveled across more than a century to deliver its message, that a mother's love can transcend tragedy, that environmental injustice has deep historical roots, and that the lives of poor and immigrant children matter just as much as those born into privilege. Michael Kowalski's eyes, which had seemed so haunting in that 1912 portrait, had finally been understood. They had told a story of corporate negligence, political indifference, and environmental racism that continued to resonate in contemporary struggles for environmental justice. But they had also told a story of a mother's unwavering love and the power of historical truth to create change across the generations. Anna's fierce protection of her dying son, captured in that single photograph, had become a lasting symbol of parental love in the face of overwhelming tragedy, and a call to action for environmental justice that would protect all children, regardless of their family's economic status or immigration history. The terrifying story hidden in Michael's eyes had finally been heard, and its message would continue to inspire protection for vulnerable children for generations to come.